Thanks, Frank. So important right now in light of Sidney Crosby's recent concussion diagnosis. Neurosurgeon Dr. Neilank Jha joins us to discuss the implications of concussions and the actions that should follow a concussion diagnosis. Good morning, doctor. So good to have you here today.
Thanks for having me, Dina.
Let's begin with Sidney Crosby. You've been studying him for a while. Do you think he should have gone back to play so soon?
Well, that's a difficult question, Dina. Sidney Crosby's the greatest player in the world right now, and I can assure you that he knows his body very well. In October of 2016, he called himself out himself and missed several games. So he has the best medical staff, the best level of care. The recent literature tells us that 24 to 48 hours later, moderate levels of cognitive physical activity. So it is not surprising that he was back by game 5, but it could have been possible that he would have been out longer.
But once you have a concussion, you say you are more susceptible to have another one within how many days?
Well, there's some literature that states 90% of second concussions happen within 10 days of the first. That's in cases where patients remain symptomatic. I can assure you that Crosby would not have returned that quickly if he still had symptoms. His symptoms had likely resolved. He had gone to practice. He did well. So the medical staff would have only cleared him, and he's aware of the risks as well.
We want to allay the concerns of parents out there. It's the worst thing to see your child get struck. People describe it as the big hit where you black out. You say that's not necessarily the case. How do you know if your child has had a concussion? What are the symptoms?
It's a good question. 90% of concussions have no loss of consciousness. So that's not a good metric. Invariably, almost all concussions have normal CAT scans and MRIs as well. So if there's any symptoms that the child has, headache, dizziness, sensitivity to light, sound, so on and so forth, it's best to sit out when in doubt and seek medical attention.
Immediately?
Immediately.
There is a hotline that helps. We'll actually have the link on our website. So you said neurosurgeons like yourself volunteer and you will respond within 24 to 48 hours, even if it's been years since you've had a concussion.
Yeah, we take a little bit longer if it's a delayed concussion. But you know, nowadays the emergency room's getting more education, family doctors are getting more education. The most important thing to do is to see somebody who has experience in the area of concussions and is able to identify when it's safe to return to play and school. You know, historically, we used to put people in a dark room for 10 days. Now we know that's not the right way to manage concussions.
Okay.
If you take a 15-year-old girl, I'll have a mother come in and say, well, Dr. Jha, I did the right thing. I took away her iPhone. She's not allowed to go on social media, and she hasn't gone to school. And then I see the daughter, and she has a lot of anxiety because she's not connecting with her friends. She's not on Snapchat. She's not on Twitter. So the right thing to do is moderate levels of cognitive and physical activity, gently get them back in motion again, and that's where we see the best recovery.
So are you supposed to keep your kids off the ice or whatever the field it is that they're playing, out of school?
Yeah, you should not return to any type of contact sport if you're still symptomatic. Once your symptoms have resolved, you've been tested appropriately, cognitive and physically, it's okay initially to return to practice. Then we see how do they do with exertion, just like Crosby did. Once they're cleared after exertion, then under the right circumstances, they can return to game playing. That being said, if you look at Crosby's case, he had a concussion in 2011 on January 1st at the Winter Classic. 4 days later, while he was still symptomatic, had a second concussion, and he was out for 108 games. And that is a great thing for the parents and the kids to learn at home, is sit out when in doubt.
Thank you so much. For more information, everybody, breakfasttelevision.ca. Right now over to Mel in the newsroom.